But we want to turn NBC5 Investigates because we have an update on our series Dismissed.
Part of our reporting last fall exposed how hospitals across the state of Illinois failed to properly treat victims of sexual assault, turning them away and transferring them to hospitals sometimes 70 or 80 miles away. Tonight or tomorrow, Illinois lawmakers are expected to vote on a bill that could change that.
Here's investigative reporter Bennett Haberly with the latest on this. Bennett.
Alex and Allison, you just mentioned the clock is ticking for lawmakers. This bill, by the way, has cleared several legislative hurdles over the past 2 weeks and awaits a final vote in the Senate. You're about to hear from a woman we've interviewed before whose experience helped shape the bill.
When a victim comes into the ER, we're already at our most vulnerable state. All right, we are looking to doctors and nurses to treat us with some human decency.
Last fall, Cheryl Thompson shared with us her story of sexual assault. She says she went to a bar on New Year's Eve 2024 to meet a friend and woke up in her driveway, feeling sore. When she went to Union County Hospital for a rape kit, she was told she needed to be transferred to another hospital 77 miles away. In her statement to police, Cheryl says the ER doctor also told her she was too tall and too fat to have been assaulted. Traumatized, Cheryl waited another 8 days before seeking treatment elsewhere.
By that time, the DNA was gone, but, the thing that has bothered me the most is that instead of trying to send me that far away, why wasn't there anything to let me know that I could have gone to Carbondale or I could have gone to Heron? Because that would have made all the difference in the world to me.
Last week, Cheryl shared her story again with state lawmakers who are now poised to make changes to the Sexual Assault Survivors Treatment Act, or SASADA. The law requires that hospitals provide proper care to sexual assault patients, but it also allows hospitals to transfer patients if they can't provide those services. NBC5 Investigates review of 185 hospital inspection reports over a 6-year period found nearly half failed to provide adequate care. And of the 85 hospitals we found with transfer agreements, more than half sent their patients 40 to 80 miles away.
We spent a great deal of time looking to ensure that survivors are centered.
The proposed change would allow the State Department of Public Health to reject hospital transfer agreements if it would cause an undue burden on victims.
12 votes in favor, 0 votes opposed, and 0 voting present. House Floor Amendment number 1 to Senate Bill 1602 is recommended for adoption.
Cheryl calls Senate Bill 1602 a step in the right direction.
Knowing that, my story has helped to propel this along, it's overwhelming.
A spokeswoman for the Union County Hospital where Cheryl was treated said no one was available for comment. In a statement, the Illinois Hospital Association says there's still a shortage of sexual assault nurse examiners, but that this new guidance, as they said, provides some creative solutions to reduce those transfer times. Again, this bill faces little to no opposition at this point. It's been sitting in the Senate concurrence calendar for days, awaiting a vote that could come in a matter of hours. If it passes, the next step, the governor's desk. Allison?
All right, we will stay on top of that, and who knows when it will come, maybe tonight. Thank you, Bennett.